Welcome to part 5 of Musculoskeletal. This PowerPoint is going to focus on amputations. Amputation is the surgical removal of a limb. This may need to occur due to a congenital issue, a traumatic injury, or could be caused by a tumor, circulation disorders, or even infection. They can also amputate a limb to control pain or disease, improve function, and even improve quality of life. The usual areas for amputations are above or below the elbows, toes, whole foot, above or below the knees. When we assess our patients, we actually assess several issues and body systems. First, we have to assess for signs and symptoms of infection at the amputation site. This is a surgical wound, which means it has the ability to get infected and dehisce. We want to assess the surgical incision for good healing. We also want to assess the neurovascular status of the affected limb, those 5 Ps. Does the limb have sensation? Is the limb warm or cool? Are the pulses still present and palpable? And we want to see if the patient has any movement of the limb. Depending on the limb and how soon after surgery it is, the limb may still be too painful or too edematous to move without assistance, especially above the knee amputations. We want to compare all of this data with the unaffected limb as well. Because we're caring for a patient with a surgical incision, we need to assess their nutrition status to ensure proper healing. Some amputated patients have other medical problems that need to be addressed, especially those with infections or circulation issues, so we need to assess those related body systems as well. Lastly, and sometimes most importantly, we need to assess the person's psychological status. There's a lot of grief that occurs with the loss of a limb. The person may refuse to look at their amputation, refuse to participate in therapy, and may struggle with coping with the major life change that they just had. Also, we need to assess for a phenomenon called phantom limb. Because the nerve endings were just cut, but the brain still thinks the limb is there, the person can actually feel pain and sensations in the part of the limb that's been removed. This can be very distressing to the person because they know the limb is gone, but the nerve endings are telling the brain that the limb is still there. Unfortunately, amputations are not without the risk of complications. There is a risk of post-operative hemorrhage because the surgery involves cutting through skin, muscles, fat, arteries, and veins, and all of that has blood supply that must be closed off. Any little area of vasculature that isn't completely closed off could lead to bleeding or hemorrhage. Infection is always a potential complication when we break the skin integrity, even with sterile surgeries. There may also be delayed surgical incision healing, and that could require additional surgeries and skin grafts to fix, like this picture. Because amputations affect mobility, the person is at risk for skin breakdown and pressure injuries if we do not change their positions frequently and start PT/OT as quickly as possible. We've already mentioned phantom limb pain, and because the amputation may cause decreased mobility to the affected limb, the person may not use the limb enough and the joint can contract or have permanent tightening of the muscles and tendons that aren't getting used. This is why PT and OT is so important when the patient is able to start moving. The goals for our patient will of course be related to any issues they may have, but we should automatically plan to relieve pain, encourage wound healing, and prevent skin complications. We also want to focus on helping the patient accept their new body, grieve the loss of their limb, and accept what life will look like for them moving forward. We also want to focus on getting the person independent with their care and mobility and prevent complications. Our nursing interventions are geared towards each of our outcomes and goals. When relieving pain, we of course want to administer the prescribed medications, but changing positions is also very helpful for amputation pain relief. To promote wound healing, we want to handle the limb gently and do any dressing changes and wound care as directed. Sometimes the wound care is very surgeon specific, so it's best to have orders from the surgeon explaining what they want done. To promote independence with self-care, we need to encourage active participation in their care. Part of this requires the healthcare team to communicate in a positive attitude to facilitate patient acceptance and participation in rehabilitation. We need to focus on their safety and mobility, as lower extremity amputations are major fall risks. When we work to help the person resolve grief and enhancing body image, we want to encourage them to express their feelings and for us to be supportive and listen to their feelings. We need to create an accepting, supportive atmosphere and encourage the patient to look at, feel, and care for the residual limb. We need to work with the patient to set realistic goals, especially with their mobility. We need to help the patient resume self-care and independence. And lastly, we need to set up referrals to counselors and support groups. When we evaluate our patient, we're hoping they feel like their pain is under control. We want their incisions to heal fully and have no other skin or wound issues. We hope the person has accepted their physical changes and that they have grieved the loss of their limb. We're also evaluating their self-care and mobility levels. With all evaluations, we need to be mindful that this is a very long recovery process, and we may need to do frequent evaluations and make changes to our plan of care. And this is the end of part 5.